Welcome to the RD Squeeze. I'm Micki.
And I'm Emily.
And we're two dietitian besties here to squeeze out the misinformation around health and nutrition.
Hey everyone! Welcome to the RD Squeeze podcast. I'm Emily Fasciano, one of your hosts.
And I'm Micki Orlowski, the other host of the RD Squeeze. Welcome. We're on episode 4.
Yeah.
Woohoo! Very exciting, and we're going to get into a really awesome topic.
Yes.
We're talking about the doctor-dietitian debacle. You could tell I like an alliteration. So
Micki comes up with all the titles.
that's like the one good thing I'm good at. No. But seriously, we're talking, dietitians and doctors and how we can kind of almost work together.
Yes.
So how this episode came about was you found this article and we kind of discussed it, or I found it. Did I find it? I don't remember. One of us found it.
It's been a while.
It doesn't matter. We found it together, and the title alone, I think, is a good way to kind of introduce the topic. So it says, diet-related diseases are the #1 cause of death in the United States, yet many doctors receive little to no nutrition education in med school. And this was published on September 25th in 2024, and we'll link this article in our notes as well so people can refer to it. But we wanted to talk about this because we have a pretty strong opinion that I don't think a doctor needs more medical or nutrition education.
Yeah.
I think they just need to refer to dietitians, and I think you can agree with the same. So my thought is, I don't know if you want to add or if you want me to just get right into my little squeeze.
For it,
I'm going for it. All right. So, my biggest thing, and I'm looking at my notes here, is, I say this to all my students, you cannot be an expert in everything. So why do we expect doctors to be an expert in everything? And this is in support of doctors, okay? This is not against doctors.
Right.
I have friends and family who are doctors, and I gotta be honest, that's why they choose a specialization, right? You don't go into residency and do every single specialization. That's why people choose, surgery, optometry, psychology or psychiatry,
OBGYN,
there's, renal, cardiac, whatever, there's always an area you can go into. So there's no doctor that's going to also specialize in just nutrition. That's what we're here for.
Correct.
That's what a dietitian is for. And I don't know why that gets lost. So instead of making it a big deal, they need more nutrition education, yes, I'm sure they could maybe use a little bit more.
More updated information.
Yeah, maybe updated.
Yes.
That would be a good point. But they don't need to they have enough on their plate. They have enough education that they need to do. That's a lot of work. We should be referring to us as the nutrition expert, right? And we are part of the interdisciplinary team, right?
Correct.
If you're going to someone who's an occupational therapy or speech language pathologist or whatever, I'm not going in and being well, this is what you should do for this. And there's specificities for a reason.
Specialization.
There you go. There's a reason. And I'm not saying you have to stay in your lane, but also it is hard we have to do continuing education, right? We all have to do that. It is hard to be an expert in everything. You can't. So there's bound to be misinformation also kind of looping into that, which we talked about, in our last episode.
Which is where, I think the updated nutrition information, yes, because doctors are not going, I've gone to multidisciplinary conferences, and if there is a nutrition session, I'm sorry, they're not going to that. They're going to the research on the newest whatever medication there is. That's what they're going for. They want to learn what they can do for their patients. Sure, it might be a pharmaceutical thing, whatever it is. They want to learn how to do that for their patient, not the nutrition side of it. So I've seen it, and I know that they're not learning about the newest and most up-to-date evidence-based information in nutrition. And every single day I pretty much have to clarify that misinformation about what a doctor may have said. And again, it's not because the doctor just said it because they wanted to. Yeah. It's because that's what they were taught. So we need to update that for sure. And I think too, to point out, this isn't just happening in dietetics, that maybe the doctor is kind of the main person and that's they're trying to do everything. That's what all the disciplines are for. That's what all of our medical health professionals are for. The OTs, the speech therapists, PT. I don't think they're utilized enough. They're not referred to enough. I had something that I should have gone to PT earlier, and when I reached out to a PT, they were like, yes, you should have come to me at your second week afterwards. So, those things are still not being referred to.
Right.
And we need to take advantage of that. So today we're talking about the dietitian side of that, of why can we be of help to you? Because we continue our education.
Well, you also bring a very good point up that is actually not in our little outline, but it just brought something to my attention too. Like, I'm thinking back to every time I needed a referral, I had to ask for the referral.
Right.
I was never referred on
Mm-hmm.
their own terms. Like, they weren't like, hey, I'm going to refer you to. I was like, well, do you think I need... That is wild to me, because then, like you said, if they're not referring to you to PT or whatever, like, you're not getting a referral to a dietitian. And another topic that I wanted to kind of mention here is, like, there is an RD shortage. And I think this is maybe one of the factors of why, is because we are not seen as that immediate expert among other interdisciplinary professions. And I'm not,
we've come a long way.
Yeah, we've come a long way.
We still have work to do.
And there's still work to do. And I think that's the problem, because, so many other professions do also want to kind of get into nutrition. And I don't think that's really necessary. Like, I've heard people say, like, that their dentist or their chiropractor or somebody has billed for nutrition. I'm like, why are we doing this? Like, I don't claim to know a lot about oral health. I mean, there's nutrition components, but I'm not like, hey, Emily, you need your wisdom teeth taken out, like, as a professional, or like, hey, I think you need a spine adjustment. Like, I'm not doing that. So I don't know why there's this need to get in here to get more money. Like, I don't understand the logic behind it. And the other thing is, like, most of these doctors also don't care about, like, what you're... Not that they don't care. Maybe they're just not interested. I don't know what the word would be. But, like, if you're going in for surgery, your surgeon doesn't want to talk about your protein intake or, like, your fiber intake or whatever. Like, they don't care about that. Yeah. They're there to do the surgery, to make sure that you're healing, which protein does come into play with that.
Absolutely.
But again, a dietitian is going to help you in the hospital with that, and you can eventually be referred out to a dietitian if you want to address more things.
Like, and I'll add on to that, like, at the facility I work at, colonoscopies are done, colon cancers, those types of things, those types of procedures are done. Not one referral to a dietitian. And so that's an area of work that could definitely be. Do you have a dietitian in surgery? Yeah. As you mentioned, there are different needs after surgery for someone to make sure they're getting. It's a quick, maybe, consult. It's not lengthy, but there are ones that can definitely be more in depth, or that would require further follow-up then from a dietitian. So where can we be used that we're not, that actually benefits the patient? Let's remember that that's our goal, is to treat and help a patient become healthier or be healthy. Right. And how can we do that? Dietitians should be involved in pretty much every area of care.
Yeah. And I think another good point is, like, that article is mentioning specific diet-related diseases. Most of these diseases are preventative, and we are not often used in preventative care as much as we should be. We are not utilized in that capacity enough. And again, I think that's lack of referrals. Like, I think it's just a lack of maybe knowledge. There's a lack of maybe appearance or, like, visibility of dietitians.
Well, you mentioned a shortage now,
well,
so
there's a shortage,
that's going to be an issue in the future.
I think a lot of, like, I've gone to doctors and they're like, oh, do you know a dietitian that specializes in allergies? Because I'd love to, I would love to refer to somebody with allergies, or, there's a need for dietitians, even like eye health, which I know sounds wild, but, like, there's a need for these specializations. And I know we're going to get to this maybe a little towards the end of the episode, but there's also a need for specialized RDs in specific areas, because again, we cannot be an expert in everything.
Yeah. And
yes, I'm educated, you're educated in multiple areas of dietetics, but in general, I would not be comfortable right now going into dialysis clinic and start,
Right.
I need to do some more education on that
Absolutely.
because I have been out of that for a long time. But
Mhm.
somebody who's been in that for a really long time is perfectly able, and like, you're an oncology dietitian, like that is an area where you specialize. Like, I am not comfortable doing that right now. Eventually I could if
Yeah,
I focus
right.
on that. I focus in a completely different area of
Mhm.
dietetics. But regardless, there is that need, for, like I said, prevention purposes. We're the biggest gripe is, oh, all these can be, treated and prevented, yet
But
I
we're not
never
doing
I
anything.
never hear
Yeah.
dietitians being
Yeah.
part of that conversation.
And
Or
I
like,
think that's also a systemic issue is like, why are we not putting programs out in place to prevent disease? Why
Mhm,
are we only focused on the only one that's out there right now is the diabetes prevention program?
mhm.
And that's typically when someone already has pre-diabetes. So
Right.
like you're
So
already just a smidge close.
yeah, so is that preventative?
Yeah, exactly. So we really should, and this is actually why I got into dietetics, was because I wanted to teach people how to nourish their bodies so they could prevent disease in the long run. Now, is everything preventable? No. There are many factors that come into all different conditions, including cancers. As much as we see that, certain conditions can cause cancer, absolutely. Smoking, alcohol intake, having a higher body fat, those types of things can lead to cancer, but also how are we then fueling our bodies or being physically active, doing healthy things for our mind, our body, and soul? How are we doing that to reduce inflammation that actually might lead to some of those conditions as well? So where are the dietitians there? I mean, in schools, in employee wellness, like that's where dietitians should really be. And I feel like it's so lacking. I mean, my one job was in a school as the school food service director, but I got to do nutrition education, and I loved doing that because it was setting the kids up to know you can still have your chicken fingers, your popcorn chicken, and mashed potato bowl, but you can also still have flavored milk and you're still nourishing your body in some way.
Yeah.
So where are we doing that? And it's lacking, I think, just in our society in the United States at least.
And on the flip side of the coin here too, we do have doctors out there that are very interested in
Absolutely.
nutrition. However, I think some of them are coming from a misinformed standpoint, or a very again, we talked about this a little bit in the past couple episodes, like the privileged aspect of, I know more than you, so here's my recommendation, when it's not really accessible to these patients. Or like you said, they don't have like us as dietitians, as a nutrition expert, in their immediate circle. They're not utilizing us the best we can, or they just are dabbling in this and they're spreading almost more misinformation than they need to.
Right.
Because again, I could easily go on, a social media platform and talk about, heart disease and and I'm sure I would say something that probably was not medically accurate. And again, we are not holding these doctors accountable for that,
because they already have a credential, but the credential is not in nutrition.
And I'm not saying that's an intended thing, like that very much is very unintended, I'm sure. Like it's just out of a place of just conversation or whatever, or sometimes maybe it is intended, I don't know. But regardless, like I just don't understand why we expect doctors to resolve all of these problems when there are other experts for that reason. Like the same thing when you are buying a house, which you just did, which we can talk about. You're not going to ask your plumber about your electricity, and you're not going to ask your electrician about your flooring and like your foundation, or like this is why we have specializations in all different areas of life. So what is the difference, and I guess what is the perspective difference on, why is it always like the doctors need to have this way?
Yeah.
Because I'm gonna this isn't on our outline level, but I'm just rambling at this point. The big thing, and I think in Pennsylvania it's on the verge of changing, or it's you can approve when we're in clinical settings, we need final approval from a doctor for most of our recommendations. Is that correct or not correct?
We need a referral from a doctor to get reimbursement.
So my thought was like, and maybe I'm
You
wrong.
mean diet orders?
Like diet orders are like a tube feed order. Like we still need that final approval, and we're working on that. Like I think there's some.
So dietitians have order writing privileges. What that means is the dietitian can physically in the chart go ahead and put heart healthy diet, carb controlled diet, whatever it might be. However, then yes, the doctor has to review and just sign off on it. So we don't have the sign off privileges of yes, we're the final say. That is also facility dependent though. So even if your state has it, your facility has to kind of implement that process.
Which there's two sides to this coin. So I'm like flipping the coin and then flipping the coin again. Like where there's two sides of this, right? Either the doctor is your second set of eyes because I think we all need a second set of eyes. And like I said, we all make mistakes. But there's also other dietitians sometimes to do that.
Correct.
So there's somebody looking at it, making sure everything's correct. Or on the flip side, if the doctor doesn't agree with you, which I've had personal experience with this, you know, back in the day, if the doctor doesn't agree with your recommendations, even if your recommendations are correct and they don't sign off on it, it can have serious implications on that patient's further healthcare status.
I think to that, like malnutrition for dietitians, we're kind of the ones to diagnose it in a verbal charting sense. The doctors have to review our chart and sign off and add it to the medical record. They can totally disagree with you and say, no, they're not malnourished. But based on the malnutrition criteria and guidelines, they meet that criteria. I've watched videos and I've even watched videos and they'll say, well, this person has moderate malnutrition. And I think, really? That's moderate? That looks like mild. But if that's what you're saying, okay.
That's still malnutrition.
So there are definitely times, and I come across this all the time, where a provider just doesn't agree that that patient is malnourished, but clinically they are.
Yeah, and that brings up another point too. Like, I mean, again, we'll talk about this a little later. Like, I think that happens a lot of times when there's somebody maybe that's in a larger body.
Yep.
And they're not malnourished because they're technically obese.
Correct.
But they are still malnourished.
Correct.
So they're like, well, they're not because they have this high percentage of body fat and they could lose weight. Now, I'm not agreeing with any of that commentary because I've made it very clear that that's not how I feel about those things. But they're still malnourished. Like, it doesn't matter. And I think that's the other thing. Like, the appearance of people is very... I don't know. I just feel like people focus on that way too much than what's going on the inside or whatever. But I'm sorry, I'm a little bit rambly, but I'm also kind of circle back to like the tube feeding thing where that literally happened to me. And because I don't want this to kind of circle back to the facility or anything. But there was a patient that I had where, you know, me and my other dietitian person, we were working on this patient and they were clearly being overfed in a tube feed setting. And this doctor would not change the tube feed order, despite our many attempts to do that. I will not, if you know me personally, you know the results of that story. I'm not going to put that on the internet. But it didn't have a good ending. I'll just put it that way. And I'm not saying doctors have that malice behind that. I would never say that. But that was such an uninformed decision on that provider's part. And that is what worries me, is like, if you want to continuously put all of these responsibilities on doctors, where does that lead us? Yeah. Like, if I need to go to medical school to be able to do this, like that's not okay. I don't know. I'm sorry. Like,
I agree. And one person can only do so much. A lot of it is medication management and interactions and ensuring that their conditions are controlled. So then when they're not, that's when you utilize, okay, well, this one's diet related. Let's refer you to the dietitian so we can ensure they're getting appropriate care. I just think you can't, I think back in the day, because there maybe there wasn't so much of a need. We didn't know a lot about chronic conditions and how diet was related to it. Now we have so much evidence that, yes, diet can try and prevent at least certain diseases. So why not use a dietitian to help with that?
Yeah.
I think just, again, getting that message through and the education that these doctors go through, it's already, as you mentioned, so overwhelming, so much. Like, yes, they have a lot to learn. Why are we going to add more nutrition in? And this kind of brings in other articles. This isn't the first article like this in the past probably 5-10 years. We've seen many like this. I think now it's just becoming a little more prominent and focused on. And culinary medicine programs, culinary nutrition programs have been added.
Food as medicine is a big, the big trending thing.
Yes.
But go ahead, sorry.
That has been added now to some of these medical schools. And it's not that it's a bad thing. That's not what we're saying. It's great to learn about that. And for me, I feel, as I've gone to, I mentioned before, other multidisciplinary meetings, that going and seeing how other disciplines do their work allows me to understand how my role can be done better, maybe, not by crossing over into their scope of practice, but how I understand what they do helps me do my job better.
Right.
That is absolutely appropriate, I think. You understand what a dietitian does, why you can refer to them because of that culinary medicine program. Great. This does not give you the credential, though, to be able to practice nutrition. Now, I do think, and I could be wrong, doctors do have scope of practice for medical nutrition therapy in their
depends on the state.
The state still. Okay. So depending on where you're at, they might be able to, just like I believe chiropractors in certain states do have medical nutrition therapy under theirs.
Based on state.
So that's based on state. But when we look at these culinary medicine programs, we're teaching more of that, I would say, the kind of integrative medicine and nutrition. Right. But why are we not actually adding that to nutrition schools and undergrad dietetics programs? I think so many people love that. And as part of my role, I do cooking classes and I do teach all of those things. I teach not just the food service side and the food safety. I teach the integrative part of why we use food as medicine, but also the prevention of disease.
Well, so I want to kind of clarify something, and you bring up a good point about education, because that's something in my, scope. That is something that's very trendy, and actually, where I work, we are doing that at the undergraduate level. We are implementing that eventually, because we changed our curriculum to make it more, I don't know, sexy, if you will, to get students to come to us. And that is a big thing. But I want to be clear about something. The food as medicine movement and the culinary medicine, there's different silos of that. And I think there's different angles we can come at it from. But medicine is medicine and food is food, right?
Correct.
Like, we're not saying that like an orange is going to cure cancer, right? That's not what this is about. It really is just kind of utilizing food as, I think, either more preventative or to help heal maybe some of the chronic diseases. It's not like anything's going to cure. Like, there's medicines that are going to help alleviate more symptoms than food is going to.
We're not replacing medicine for food only.
Right. And
we might use in conjunction. We might find that some foods do help, but it's not going to replace.
But I think it really should be part of the preventative aspect. Because
Agree.
I mean, something we're talking about too is like overcoming scope. Like, I'm definitely not trying to get into a pharmacist, job. And I don't think pharmacy, unless you're a pharmacist and a dietitian, that's awesome. Because I do know some people do that. We know someone in particular. And maybe we can have them on the podcast one day. Who knows? But like, there's definitely some overlap, and you can be multiple different disciplines as well. But there's no one saying like, oh, nutrition is going to overtake medicine.
Right.
But in terms of that prevention, I mean, you kind of mentioned it, I think, in our last episode, medically tailored meals. Like, I think that's another component where it is very specific, like medical nutrition therapy, because we're utilizing food to help with those diseases, I guess.
Right.
So I just think you bring up a really good point, but I wanted to clarify that. I think sometimes that gets like, there's a lot of programs coming out, and I think there is a lot of investment in these food as medicine programs or culinary medicine.
Yes.
And they're very hot right now, especially with funding and at a public health standpoint. But it is not going to be a cure-all. Like, there is no way you are going to cure certain things without medication.
Right.
Or resolve them without medication. Like, there are things that you need medication for.
Well, and I think, again, we need MDs. We need doctors to be there for the patient. And here's the other thing. Your time with a patient is limited. So why are you taking more time for maybe nutrition that maybe you are not most well up on? Or if an article comes out, we can talk about these in the future, that, you know, it comes out about one thing. I'm going to use the red meat article that came out that said, go ahead, eat as much red meat as you want. At that point, you have no idea how many doctors, or I should say, how many patients came to me and said, well, I was told I can eat as much red meat as I want. So now we're getting that misinformation again. It was an article that was taken out of context, and they kind of worded it to make it seem like red meat is fine. Unfortunately, that's not the case. Yes, red meat here and there, totally fine, but we're not going to eat it every day, okay? So we have to, again, understand the evidence, look where the article came from, and see. So doctors should spend the time with their patients to understand what's going on, listen to them, and be patient-centered. Yes, if that patient-centered is focused then on diet and nutrition and lifestyle, that's where the referral comes in. You don't need to spend your session talking about that when you probably could be talking about medications, or, hey, have you gone to PT, and other referrals that could happen. When you look at that whole person, you're taking into consideration their mental health, their relationships, their physical activity, their sleep patterns. But unfortunately, when I go to the doctor, I don't get asked any of those questions. I get asked about, well, are you losing weight? Are you doing this? Are you eating fiber? And I'm like, yes, I'm a dietitian. Thank you.
Which that brings up a whole nother point. How many times I've gone to the doctor and they're like, oh, you haven't lost any weight, or like you should follow, like, they've recommended me the Atkins diet at one point, and then I'm like, oh yeah, I'm a dietitian. They're like, oh, well, you already know what to do. And I'm like,
Thank you.
I guess, yeah, sure. I mean,
but there's other things that could be affecting.
Yeah, like, why is that automatically the assumption?
Yes.
And also, you know, not for nothing, it's a lot easier to give other people advice and take your own. So, like, that's something to consider.
Absolutely.
But that doesn't mean like the doctor can then bill me for nutrition counseling after they said,
right,
you should follow the Atkins diet. I'll see you in 6 months.
So I think you mentioned earlier about the coding and the billing and stuff. I think that can maybe be a part of it. But again, we want to give you your time to do the most important things. And that's fine if you say the basic things of, like, are you eating, sure, what I mentioned, the fiber and, you know, having fruits and vegetables, things like that. But if you feel there's something more there, refer to the dietitian, have us do a full assessment to see, because sometimes, in many cases, it's the food access, it's an underlying eating disorder, they just had no education before, and you don't have time for the education as a doctor. So we're trying to actually respect your time and say, just send them over to us. It's okay. Go ahead.
Yeah.
You know, give us that. We'll take them and help figure out what's going on.
Yeah. What's so wrong with that? Like, I never understood that. What's so wrong with admitting that you can't answer the question? Like, I always say that to students too. I'm like, there is nothing wrong with saying, I don't know. Let me look into it for you. What is so wrong with the doctor saying, you know what, that is not my area of expertise, but I know a great dietitian that I could send you to, or let me refer you to this professional. There's nothing wrong with that. You would do the exact same thing, you know, for dermatology, for, you know, like a gastroenterology. You would do that for any other profession. Why is that so, like, taboo to do that?
I think what I wanted to mention probably in the previous episode too, was we do all eat. We get that. And we all find foods that work for us. We find foods maybe, you know, if we find a healthy lifestyle, we know those foods work for us and give us that healthy lifestyle. That doesn't mean we're the expert, though. That doesn't mean we can go and give that unsolicited advice to everyone we come and encounter with. So yeah, I think we just really do need those referrals. We're here for you. That's what we're saying. We are here for you. We want to take that time to spend with the patient and not rush them. Yes, sometimes we do have quick appointments too, but that's where we can follow up with them more frequently. We can talk about reimbursement in the future, but use dietitians. We want to be there for our patients. That's why we went into this profession. And I think then kind of leading into our next thought was the specialization of dietitians that you mentioned earlier. So not just our, your doctors, MDs, and all of them, do they have specialties? Dietitians now have specialties too. And I feel like in the past like 5 years, it's just grown immensely on how many specialized dietitians there are. And it's actually becoming required for some positions. So I'll use my example, my oncology position. I don't need the specialization. I don't need to take the test, but we have, I believe I want to round up to like between 8 to 10 specializations in dietetics for different disease states. And I mean, that's from eating disorders to GI to obesity. Oncology is one, pediatric, I'm forgetting renal, geriatric. So we have a lot of specializations. What this means is all dietitians, just as an MD, have your basic kind of knowledge to be credentialed as that. Then we can go into that specialization. It requires experience. So I think for newer dietitians or students especially, to hear that experience really does matter. I've been there. I wanted to be a sports dietitian immediately when I became a dietitian. It wasn't happening. You had to have a certain amount of hours. You had to work with your clients. Then you had to take your tests and all that. And so studying for that and everything. The experience really does shape how you give information, how you understand your patients, and the then respect that comes with that. If you're a new dietitian or student who feels like, no, I know everything, I got this, I'll go and see my clients. I've been around students, the know-it-all attitude comes through. And we want to respect our profession by acknowledging we don't know everything just yet. So take that time to find the experience, get that experience. That's fine if you want to take your test and then be specialized, but it doesn't necessarily mean you know everything still, because I took a specialization test. I did not pass it. And I don't know if I'm going to take it again because I did not feel the test represented what I do well with my patients for the care that they need.
Which that is a whole
That's
topic
another episode.
we can totally talk about, because this is the exact same problem we're having with the RD exam. So that might be in a very soon upcoming episode, because you can speak to that. I can certainly speak to that. So, stay tuned for that episode. But yeah, I totally agree with 100% of what you said. Like, I don't think there's anything wrong with finding that specialization. Like, I just was talking with a student too, that they were really interested in wounds. Like, they wanted to be a part of like the wound care team. And I was like, that's wonderful, because honestly, probably a lot of us don't want to do that, because it's not the most glamorous job. Okay. But regardless, there's nothing wrong, with doing that. And like I said, sometimes you do have those career changes, and there's also nothing wrong with having a career change. But just know that, like, if you are exclusively working with diabetes patients, you might not always be the best oncology dietitian, or you might not be the best renal dietitian, but you can transition for sure. Or if something naturally speaks to you and that's what you want to pursue, you can absolutely pursue that. And that also doesn't necessarily mean in the clinical field. I mean, I think I said this in the introductory episode, like, I am not a clinical dietitian at heart and never will be. So I pursued community, which is more on the systemic policy, food accessibility standpoint. And I really thought that that's where I was going to kind of lean into. And then I ended up transitioning to education. So I'm very much more like, I know I could talk about accreditation and the RD exam all day, but you asked me to, solve a case study on oncology, I'd be like, Emily, I need your help. But like I said, I can't study everything all at once, and there is a reason for continuing education for that purpose, to keep us. But again,
you still can't do everything.
That is not my comfort zone. My comfort zone is in a completely different area. And same thing, I'm thinking of the team of dietitians I work with in my department. We all have like really good areas, and I'm certainly not volunteering to teach biochem anytime soon. Like, that's not my area of expertise, but community nutrition, health promotion, anything like that, 100% sign me up.
Right.
So again, there's nothing wrong with that, and finding your niche is completely okay to do. So I don't know. I don't think that's such a bad thing, because, you know, same reason why other medical professions, you know, have their own
It's needed.
specializations. Yeah,
It's needed these days. And as you mentioned, we can't know everything, even as a dietitian. I'm not going to know everything.
Yeah.
And I am going to be the first one wherever I work to say, I don't know XYZ. Give me a TPN, no thank you. Give me a tube feed, sure, you know?
Yeah.
But, you know, so I think going back to the MDs and doctors and just healthcare in general, referring to finding those specialized people. As a dietitian, we have specializations. Depending on your area, you might have more specialized areas if you have big medical centers. If you're looking for community dietitians who kind of have their own private practice, that might be where you find someone who's more specialized, or maybe they're just general and they can do things at a proficient level, but they're not going to be, you know, going into being experienced and excelling in knowing about GI or oncology or things like that. Right. They can give that kind of general advice, which there's nothing wrong with that to start. And then I think it's as part of our code of ethics as a dietitian, if you do not feel comfortable and competent providing that care, you should be then referring out to another dietitian. There's nothing wrong with that. Yeah. Again, if you are an MD, you're referring to a GI specialist. If you don't know, if you're kind of thinking, there's some GI maybe there, let me refer you. Same thing for dietitians. So again, I think we're going more into that very specialized realm in nutrition, and just with more of like the gut microbiome and how that influences some of our health conditions. You know, that's a whole different area of specialization. I think that's really cool. I don't know much about it. Yeah. So, you know, I know the basics, but I can't dive into it maybe where that might be where functional nutrition kind of comes in a little bit more.
So there's only so many hours in a day, right? Like, as much as I love nutrition, I don't want to be spending 24 hours a day, you know, looking at all the most recent research. Like, it's not going to happen every single day for me and not for anybody. But I just wanted to see, did you have anything else that we didn't get to touch on that you want to touch on during this? Because I want to end on something.
I think we're good because we talked about the specialties, so in nutrition. But go ahead before your thought.
Have you ever watched Parks and Rec?
I haven't, no.
It's such a good show. It's one of my favorites. But there's a quote by Ron Swanson, who is played by Nick Offerman, and there's a quote, and it's, you don't want to half-ass one, like many different things, you want to whole-ass one thing. And I think that's
perfect.
Like, maybe not the most professional way of saying it, but like, you just, I think just having that specific focus instead of being in a million different areas is super important. So
again, it's good to get that knowledge, and I think I'm not even a seasoned dietitian, I would call myself, but having the experience I have, seeing how much I've been able to do and gain knowledge in, I wouldn't take any of it back. I would rather continue to get more knowledge in all those areas to then be able to say, this is what I really want to do and work in. So younger dietitians, students, think about that too. Don't just focus in on one area maybe that you really do want to work in. I get it. Like I said, I've been there, but really try and broaden your scope so you gain that knowledge, that experience to bring that to your patients then.
Yeah, I think that's a really good point. Okay, so I think that's a good place to wrap up. So let's do our sweet and sours for the week.
Sounds good. Okay.
All right, cool. So do you want me to go first with my sweet?
Sure.
All right. So my sweet is, I'm just like really obsessed with my dog right now.
Aww.
His name is Scamp. He's a Shih Tzu. He's 4 years old. He's like the best dog ever. He's just so cute. And like the one day I wasn't home at night, so my mom was watching him, and he just ended up going onto my bed and sleeping at night, even though I wasn't there. And it was just so cute. So I was just like, you're the best. Like, I love him so much. So he's just the best dog ever, and I'm just very sweet on him right now.
He is very cute, yes.
How about you? What's your sweet?
All right, my sweet is that I get to cook Thanksgiving dinner this year, the first time in my house. So I'm excited for that. Yeah.
Nice.
It's my favorite holiday. So
I know. And it's exciting because you're in your new house.
Yeah. Yeah, it'll be fun. So how about your sour, Micki?
So I don't know when this episode is coming out. I know we have like schedules and everything, but If it doesn't come out around this time, or it does, I'm so sick and tired of the political flyers, texts, emails. Like, I'm not getting political right now. I'm just saying I'm so sick of them,
It's
because
excessive. Yeah.
honestly, like, even if a flyer came in the mail, like, is that really going to change who I'm voting for?
Right.
Probably not. The texts, I understand they're like polling, but they're just getting so excessive. So I just can't wait for that to be.
And the scam calls.
Yeah,
Oh
I just can't wait for that to be over. Like, I'm very into politics, and like very, I'm involved.
Right.
I'm not bashing politics. I'm just so sick of that stuff. Like, it's getting annoying. So I'm very sour on that right now.
Yes. Oh, that's a good sour. Let's see. What's my sour? My sour is that I still have to paint a few rooms in my house, and I'm really not like a house like do it yourself person.
Yeah.
And I mean, I've painted before, but I mostly watched. I think it's the taping and like the prep work.
Yeah.
Cause like I've spent hours doing trim already, painting doors, cause they're like that off yellow color now.
Yeah,
and I'm like, ew, they need painted.
Yeah.
So the prep time, and then that probably is just the worst. And clean up of painting, then you gotta go clean your paintbrushes and stuff. Like, oh my gosh.
Yeah, like the physical act of painting is actually probably very soothing. It's just everything else revolving around it. I'm very much like you. I'm not a do-it-yourself gal. I would much rather be like move-in ready, or pay somebody else to do it, even though money doesn't grow on trees.
Right, yeah. We did that initially. We paid a couple people to do a couple things around the house, and then like now we're like, no, we'll just do it ourselves. We have some other projects we want to do to save money for, so. But yeah, this is just, and then it just takes forever, because you think you're going to get done with something in a certain amount of time. And then you're like 3 hours later, I'm still on this.
Yeah, I know. All right. Well, that seems like it's a good place to kind of start tying ends together here. Just a couple things I wanted to mention too, since we've kind of alluded to a couple things in the past couple episodes. So one is if you're listening and you have suggestions of any topics that you would like us to hear, or if you see like an article or video or anything that you would want to, us to cover, please send it to our socials or our email account, or comment. We're very engaged, so please make sure that you're doing that. And also, we've kind of talked about maybe having guests in the future. So if you are somebody or know somebody that would be a good guest on our podcast, we are going to start eventually doing guests.
Season 2
is when, so we're going to break ours up into seasons. So we'll have a few episodes come out, and then we'll move into a season 2. So I think season 2 is going to include some guests. So if you are interested, please also connect with us. We'll have lots of topics to cover.
Absolutely.
But, and then obviously, the usual, follow us, like us, subscribe, all the fun things. But anything else to add?
No, I think that's it. I think we'll end episode 4 today. On the Dr. Dietitian Debacle, again, promoting doctors, but give your patients your time back. Refer to your dietitians, all right? And then we'll see you on our episode 5 next here on the RD Squeeze podcast.
Bye, everyone.
Bye.
Be sure to follow us on Spotify, YouTube, and Instagram. We will always take topics you want to hear about, so message us for any topics you want to see covered on the RD Squeeze. Don't forget, it's Dietitian with a T. We'll see you next time on the RD Squeeze.